3 days.
Okay,
3 days.
so will you start again? Just read out and then you act it out afterwards.
Okay. You have been nursing an elderly patient who had hip replacement surgery 3 days ago. The surgeon has seen the patient today and has arranged for them to be discharged tomorrow. You have been asked to discuss the discharge plan with the patient. The task. Make sure that the patient has support from family or friends on a regular basis until he or she regains his or her independence. 2. Ask if the patient has any other concern about going on. 3. Reassure the patient that the physiotherapist will provide education to the patient and family regarding patient mobility. 4. Explain that the pharmacist will deliver medication before the patient is discharged. 5. Explain that the patient will need to make an appointment to see the GP, who will check his or her wound and reinforce the dressing if necessary. And lastly, inform the patient to call the hospital if there are any major concerns, such as excessive pain despite taking medication, bleeding from the wound site, or an elevated temperature.
Okay, so
hello, good afternoon.
Hi, good afternoon.
How are you today? Yeah, I read from your case notes that you had hip replacement surgery 3 days ago.
Yeah.
How do you feel now?
Well, it's been a very hard time. I'm just still, I don't know if I'm allowed to walk or not. Can you hear me?
Your friends, yes, I can. I hope your friends or families, they are around. They're always around to check on you.
Yeah, sometimes, you know, they are all very busy.
But at least one of them is always around, isn't it? It's just to cheer you up and make you feel at home. One of them should be around. Yeah. Do you wish to go? How soon do you wish to go?
As soon as possible.
All right. Is there anything you want us to do for you before you leave? Before you are discharged home?
Well, I'm just wondering about my mobility. Will I have support, you know, at home, gain my independence back?
Absolutely. We are working towards that to make sure you are back on your legs. The physiotherapist, don't worry, that will be done. That will be done by some of us. You know, it's a teamwork. The physiotherapist is there to exercise your legs and then to figure out what and what should be put in place for you to for you to regain your mobility totally. The pharmacist as well will give you some medications home so that you can be taking. Some of them relieve pain, and you have some for other purposes. All those things have been put in place. Then you can always come and see we'll definitely give you an appointment. You come, we check the wound size, we see how far you have improved your mobility, the size of the wound, and then if you have any other complaint or any fear, so that we can clarify for you. Then let me take a look at the wound size again. Okay, I think it's improving, it's better. But don't worry, You still be given an appointment, maybe two, maybe once, maybe twice. You come around and check the size of the wound. Yes. But if you have any complaint, maybe you are experiencing pain, you can just come back at any time to lodge your complaint. If you are experiencing pain at the wound site, so you observe that the wound site is bleeding, or any other complaint, or you realize your temperature, your body temperature is going above normal, any complaint or any other, apart from the ones I just mentioned, you can just come back and stay into that. Do you have any questions to ask me?
What about my medications?
Yeah, like I told you, I said the pharmacist is on that. The pharmacist will handle that. I'm sure by now they would have passed the medications you are taking home, and the prescription will be properly explained by the pharmacist.
Okay. All right. Thank you.
Okay. See you on your next appointment. Take proper care of yourself.
Okay, thank you. Okay, so that was not a bad one. Okay, but I see this is just raw. Like you said, you have not done it before, so it's raw. There are certain things, certain skills you need to put in place when it comes to OET speaking. Then, oh no, you have the task, but it is not just about fulfilling the task. You know, it's also about using the right skills, the right strategies in fulfilling this. So I'm going to share with you some of these strategies that we use for OET speaking. There are 10 major, what I'll call it, 10 themes, templates. Some people you call it templates, some call it strategies. So I'll say 10 things you have to follow for OET speaking. Okay, 10 templates. So it could be more than that, but let's just call it 10 for a start. For every discussion, okay, for every role play card, you might use all of the 10 templates or maybe some of them, okay, depending on the card. We know there are different situations. So again, I'm going to ask you, have you attended, if you have not attended the OET speaking class from the e-portal, please go and do that. Otherwise, there'll be a lot of things I'll be missing because this class is supposed to be a revision class and OET practice class.
Okay.
So do make sure that the main details have been explained in the class. I'm just going to go through this template here. So first of all, when you receive your OET card, remember you will have 2 role play cards for your exams, and you are to spend 10 minutes each. So in total of 20 minutes for the OET speaking. But you have 5 minutes actually per role play card. The other 5 minutes is inclusive of maybe your preparation, question and answer, or things like that. So you have 5 minutes to speak, to talk about everything in your task. Okay, so we are given the card. Your interlocutor, who is most times your examiner, will be your patient, and they will have their own role play card. So the patient's role play card is sort of written in such a way that the patient will know what to say. You will not have access to the patient's role play card. Okay, and the patient will not have access to your own role play card. But the more you probe your patients, the more information you get. There are some information that are already in the role play card of the patient that you have to look for the patient to give you. For instance, the patient could have, just like the one you finished now, in their role play card, that there was a recent example that patient need to ask you about a medication. So if the patient did not ask you about a medication, you will not be able to answer or just go ahead and be talking about medication. Patient needs to ask. If patient is not asking, you need to prompt the patient to ask questions so that you can, provide answer of so. Okay. So going back to the role play card, you have your role play card, and you are to, like this one you just, one thing that is very important that you need to identify or be able to know, where are you? What's the situation like? What's the setting like? What's the setting? Am I in a ward? Am I in an OPD? Am I in a clinic? Am I in a theater? Where are you at the moment? According to the role play card, what is the setting like? The reason why you have to know the right setting is that the way you interact to a patient that you have never met is different from the way you interact with a patient which you see day by day in a ward situation. In a ward setting, you are the head nurse. Of course, you are familiar with this patient already. You should be familiar with the patient. Unlike a patient that's coming to OPD clinic, that maybe you haven't even met the patient. So the aspect of you establishing rapport, no, it's very important when it comes to OET listening. So you have to establish that rapport. You can't just jump and just be asking questions because you want to do exam. So they really want to see your communication in that area as well. Okay. So once you get your role play card, of course, you need to introduce yourself. Your role play card can tell you are the next head nurse, you are the junior nurse, you are the student nurse, or they may call you whatever name, whatever category or role. So you need to introduce yourself to the patient in that regard. Okay, say, hello, my name is so I'm a nurse in this unit. How do others refer to you? I'm a nurse in this unit, I'm the head nurse, I'm looking after you today. Or if you have been seeing this patient before, you can say, oh, hi. That familiarity will be there, and you need to voice it out, not informally, but you need to stress that, oh, that Mrs. Anna. Oh, good. How are you today? How was your night? Just establish that rapport. Were you able to sleep last night? So then you introduce yourself, and then you ask the patient to also confirm their identity. So you can say that directly or indirectly. You can ask directly, what is your name? How do you prefer to be called? Can you confirm your name for me? So all those are part of introduction. And then you introduce yourself. For instance, if we can say, good afternoon, my name is Nurse Ola. I am working with you today. I'll be looking after you today. How can I help you? Okay. So that is how to do introduction. Or you can say, hello, Mrs. Maybe you know the patient name, or it's written in your role play card. Oh, Mrs. Ada, how are you today? Okay. How may I help you? So that's introduction. So after that, depending on the situation again, most times the patient will come with complaint, will have something you want to talk about a complaint or a concern. So you have to say, oh, I'm very sorry. If a patient say, I'm in pain. Remember when you asked me as a patient and you said, how am I? And, my response was that I'm not too bad. When you said any pain, I said, it's not too bad. So you have to respond to everything the patient says. You have to have a response. Okay, and that comes with your sympathy. Okay, that's it most about your sympathy. Take history. History is, you want to make sure elicit information from the patient, ask patient question, probe the patient, like probing. You know, you need to use all these skills of probing, and I've talked about sympathy. So you can say to sympathize, you can say, I appreciate your concerns. I know you are worried. Would you mind if I ask you further questions regarding this situation? So that's how to show sympathy and also history alongside. Now, it's important that you learn to clarify. So while you were talking there, I realized that, of course, you don't really understand, what this is all about. And most of your response then was just straight, like you want to fulfill the task, okay, which is not always right. Don't just be in a hurry that you want to fulfill the task. So clarify. The patient says something. Maybe your patient said that I'm not hungry. You can say, what about your appetite? Do you have appetite at all? Are you eating well? So clear means you are asking question due to a previous response. Excuse me. So ask those questions. Do you have
Okay.
appetite? Are you eating well? Do you have any symptoms, or have you had any symptoms? So if the patient said, oh, I'm not feeling well today, don't just say, oh, sorry about that, and go ahead. You have to continue to probe. The more question you ask, the more answer you get, and the more the rapport is built. Okay. So depending on the situation again, so you have to be mindful of the situation. Don't worry, you have about 2 to 3 minutes at the beginning of your role play for you to think through what you are going to say, and if possible, make some jottings, at the side, like, this is what I'm going to talk about, this is the way I'm going to approach it. So you have about 2 to 3 minutes to do that. Now, if you're talking about a site, maybe pain, fracture, or something that has to do with sight, you can ask questions like, which part of your body is affected? Could you tell me where the pain is? Can you tell me where it hurts? All those kind of specific questions that are, directed to a particular place. So that's how to go about the sites. Duration. If we're talking about pain, you want to ask how long, where is the place, what country is the patient coming from? When did this start? How long have you been suffering from this problem? How long have you been feeling like this? So those are ways to, talk and ask patients some questions. Now, of course, if you are taking history, you need to end the history. So you can always end an aspect of a conversation by saying, is there anything else that you want to tell me? So you don't have to wait till the end of the conversation before you ask that question. So in between, you can say, are we all clear? Would you like to, show more light into this situation? Or, do we like to show more light? So that's one way. Now, diagnosis, maybe a patient has a particular diagnosis and you want to share with the patient maybe the management or details of the diagnosis. Then you can explain. This is another way you can explain what the diagnosis is. Patient might not understand. Explain what the diagnosis is. Explain what the situation is so that the patient has a common understanding. Okay. Now, management, if you are advising a patient, or maybe you are teaching a patient about a particular life skill or procedure, you might want to follow this pattern. So, for instance, maybe use of medication, you might want to do that to explain basically what the medication is all about, what is it used for. So, if it has to do with some coping strategies as well. So it's you really categorizing what am I talking about at this time, and how am I going to go about it? What kind of questions is really should I be asking? Okay. So another way you can, if you want to get the patient, if you want to get the flow of the patient and get involved, you can say, oh, is it a good time to talk? Or is it a good time to, are you free to talk about it? Do you want me to come back another time? So ask those questions. Then don't forget to be reassuring. Be reassuring, be reassuring, be reassuring. Assuring is not, oh, I'm sorry to hear that. That is not reassuring. Most people will just say, oh, sorry about that. Or you say, don't worry, everything will be fine. Yeah, everything will be fine, but you need to be very specific with your plans, with your reassurance plan. So you can say, be rest assured, this is quite common. If nothing gets alarmed about, then you already provided, you can talk about the discharge summary with the patient, reassure them. If the patient has an eczema, just get along with those words that I've put there so that they know that you're really there for them and not just trying to discharge them. Sometimes you have some reluctant patient. How do you deal with reluctant patient? Some case notes, you will have it pointing to the fact that case note, you can find it like patient might be very hard. Maybe the patient refuses medication or refusing a procedure and you have to talk to this patient. So first of all, you can say, I really appreciate your concern. I can understand your views, or I know how you feel, but right now. So you can go through that approach, then come back and reassure them once you have established that part. Okay, that's 6. And then number 7 there is checking understanding. Okay, so it's very good that even when the conversation is going on, you don't just you don't just continue, to talk. You have to check understanding in between, which is one of the things I didn't see in you. Yeah, you have to check understanding. You are talking to a patient, pause and ask, do you understand what I've just said? Is that clear? Do you want me to repeat myself? Do you have any questions so far? So including questioning, if you have any doubt, you must check understanding so that you are sure that the patient got the right information. All right, so signposting. Signposting is another way, for you to get a good deal out of your OET speaking. First of all, like using signposting means that you are highlighting some words. Okay, you're highlighting some words used for your photography. Okay, so I think, are you there?
Yes, I'm here. I'm listening.
Okay, so signposting. Can say something like, oh, I have to highlight, I have to emphasize. Those are words for you to use to signpost. Like say, first of all, very importantly, you are calling the attention, that's signpost, you are calling the attention of that person to what you want to say. You can say something like, therefore, however, for this reason. You can use something like, I think you have a very good, that was a good question. I'm going to answer you now. No, it's a good idea. So you are bringing up words to call the attention of that person to what you are saying. So that's how to signpost. For instance, maybe you want to talk to somebody about medication management. You can say, it's very important. I must say, you can say, I must say that it is very important that you use your medication at the right time. That is signposting, because you are calling the attention, saying that, see, what I'm saying is important. Listen to me. That's what you're trying to say. Now, to end it, most of the time you end your conversation by saying, do you have any question? Hope you feel better soon. That's if the patient, depending on the situation, you can say, I would like to see you in a week. Don't hesitate to call me if you have any concern, or don't hesitate to, check back if you have any concern. Now, there are 10 special cases which over time, as you practice, you're going to get used to. Breaking bad news. Maybe you have a case those where you have to break. Excuse me. Where you have to break bad news to a patient. So how do you go about it? So you will use what I call like some tactics. Okay. First, let's look at this. June, we have received your test result back, and I'm sorry to tell you that the cause of your symptoms could be more serious than that is a risk. So you can say, I realize that this comes as a shock to you. I'm very sorry that you're going through this pain. It's very important that, that's just some of the ways to go about it. You are being calm, you're using the right tone, a low tone, soft tone, very tender, speaking slowly and softly. That's how to break bad news. So when you finish, like, you can say, it may be a good idea for you if you want to talk to somebody else. Please let me know. Do you have any relative or close friend who can help and support you? So that's a special case. Another special case there is when you have to refer a patient to a dietitian. So I'm going to share this so that you go through it. Physiotherapy is exercise, starting in insulin, alcohol addiction, quit smoking. So what I'm going to give you this as an assignment is just go and do your own background revision on cases like this. Quit smoking. What are you
Okay.
supposed to say? Like it's education, alcohol addiction, how to start insulin. Maybe you are to teach a patient on how to start insulin, or explain or clarify some anything that
That's
is
fine.
using. Exercise. So that's all about that. I'm going to leave you to that, to use that as your just a background work for you to do. So, like I said, the OET speaking,
Okay.
very interesting. Usually, honestly, I don't think anybody should fail it, because this is something you do every day as a nurse. You talk to their family. But in this particular regard, they want to look at some skills, which are some of the things I've highlighted. They want to see
Okay.
how attentive you are, active listening, because you're going to be right there in front of exam. This is not going to be virtual. So your body language, your gestures, your facial expression, your posture, all is very important when you're speaking. And they really want to see your command of English, your tenses, that you're using the right tenses, you're using the right intonation, pausing where you're supposed to pause, and not just speaking, straight like that, asking questions, getting feedback from the patient, which is very, very important. Introducing yourself to the patient before the start is very important as well. So thank you very much. That's all I will take today.
Okay. Thank you, ma'am.
Yeah,
Thank
so
you so
continue
much.
what I
Thank
say
you.
is
Take proper care of
either you
yourself.
have a
Since you have cold.
yeah, yeah. After you have a partner, either you have a partner or not, say you can still practice your speaking, just stay in front of it or of a camera or of your camera or your phone and speak to your phone and record and send it to me just for me to assess and give you a feedback if that's okay. All right, thank you very much.
All right. Thank you so much. Yes, yes.